Know about emotions and intimate relationships. In this video, you will learn about living with HPV-related oropharyngeal cancer. This includes knowing how HPV-related oropharyngeal cancer affects your emotions and sexual relationships. How HPV-related oropharyngeal cancer affects your emotions. Finding out you have a diagnosis of HPV-related oropharyngeal cancer can bring a mix of emotions. You might feel fear, anxiety, or guilt related to your cancer and what this means for you, your spouse, or partner. Many people feel hopeful when they learn that their cancer is caused by HPV. This is because most patients with HPV-related oropharyngeal cancer will respond better to treatment and will have a higher chance of being cured. Other people may have a hard time understanding how their partner became exposed to the virus that caused the cancer many years later. It can be hard to find answers to how we feel. We may search for answers on the internet, but this can confuse us more as there is also a lot of incorrect information found on the internet. It may be hard, but talk to your partner about how you feel. Talking openly to your partner and your healthcare team will help you understand more about the virus. You can also watch the video called Know About HPV to learn more about the HPV virus. If you or your partner feel you need emotional support or support on how to discuss your HPV cancer diagnosis or treatment with your loved ones, speak to a member of your healthcare team. Your healthcare team can help you get the support you need. How HPV-related oropharyngeal cancer affects your sexual relationships. HPV is a virus that is spread through sexual practices. HPV infections of the tonsils or back of the tongue can be caused by oral sex. It is not known if deep kissing, open mouth kissing with tongue-to-tongue contact can spread the virus. HPV infections are not spread through normal day-to-day contact like a kiss on the cheek or lips, or using the same toilet seat as someone who has HPV. If you have HPV-related oropharyngeal cancer, this does not mean that you or your partner has been unfaithful. This also does not mean that you or your partner have had risky sexual practices in the past, such as having more than one lifetime sexual partner. If you have HPV-related oropharyngeal cancer and have a spouse or one long-term sexual partner, you do not need to change your current sexual practices. You do not need to change your current sexual practices because your spouse or partner likely already had the HPV virus and no longer has an active infection. If your spouse or partner has HPV-related oropharyngeal cancer, you are at low risk of getting an HPV-related oropharyngeal cancer. This is because you have likely already been exposed to the virus and it has cleared your system. If you are male and your partner has HPV oropharyngeal cancer, there is no screening test to see if you have or had HPV. If you are female and your partner has HPV oropharyngeal cancer, you should continue getting regular pap tests. This is because HPV can be passed from the mouth to the vagina. If you have HPV-related oropharyngeal cancer and are not in a monogamous one-to-one sexual relationship, follow safe sexual practices to prevent the spread of the HPV virus. Safe sexual practices include using condoms and dental dams. Condoms and dental dams may protect both you and your sexual partner against some HPV infections. Talk to your healthcare team about questions you have about your sexual relationships. In this video, you learned about living with HPV-related oropharyngeal cancer. This includes knowing how HPV-related oropharyngeal cancer affects your emotions and your sexual relationships. Watch the next video to learn about HPV.